next speaker is Professor Dr. Rajesh Joshi from Nagpur, and he will be speaking on medical records, the most important evidence in the courts of law.
Good afternoon, everyone. Before I begin my topic, I just want to know how many of you are using EMR or electrical medical record for your OPD patients. I think most of you are using electrical medical record for your patient. It's good. Now, what is the importance of record keeping? Evaluation of your own results, data for scientific presentation in conferences, analyze the data for paper publications in peer-reviewed journal, and helpful in medical litigation. The last one is very important. That is why we are here. The legal system relies mainly on documentary evidence in situation of alleged medical negligence, because poor records means poor defense, but no records means no defense. Now, if you see the initial days, we used to keep all the records in a room which used to be look like this. So large room used to be required and difficult to retrieve your record if at all you need for medical litigation, or if you refer to your records previous, if you have any patients who have gone for surgery or in for your consultation. Now, electrical medical records most preferred method because it is neat and tidy, easily to be stored and retrieved, but only problem which is with this record is that you need to have a person who will look after this whole data. If you are only person in your clinic, then it would be difficult to retrieve, may not get time to retrieve from medical record also. So you need to have a dedicated person for that. Data can be easily retrieved, prescriptions is fully typed. That is very most important thing of these medical records. Now we will see one by one how this medical record keeping is important as far as patient care and to avoid the litigation in your practice. Now coming to history records, how it is important. Cataract surgery which went uneven pool, but there wasn't any improvement in the vision, and patient approached consumer forum. Now the operating surgeon is questioned about the result, but the result was in favor of doctor, because in history note it was clearly written that decreased vision in that eye since childhood. That patient had a amblyopia, and the doctor has written in the case sheet that the patient is having amblyopia, so he may not improve afterwards. Documentation of clinical findings, they are also very important. Cataract surgery which was uneven pool, and the patient had recurrent post-op inflammation and iritis with all possible treatment. Eye ultimately went into phthisis because of all the treatment. Patient approached consumer forum about this problem after post-cataract surgery, but the result went in favor of surgeon, because pre-op documents clearly mentioned that patient had a complicated cataract, patient was given pre-op steroids, and everything was done pre-operatively, and patient was explained about the prognosis post-operatively also. So this is how the patient, this is how the doctor escaped from the litigation. Now investigation and documentation of this investigation, why and how it is important. Cataract surgery in diabetic patient, patient did not improve, patient approached to the consumer forum about non-improvement of the vision post-operatively, but the doctor escaped due to pre-op OCT findings which was suggestive of the diabetic macular edema, and the patient was given anti-VEGF. So the documentation of the records about the OCT and everything is very important as far as your medical records are concerned. Now about the pre-op care and its documentation. Patient developed endophthalmitis in early post-op period. Case filed in consumer forum for compensation for non-improvement in the vision and the trauma to his mental and physical health. After the cataract surgery was performed, patient developed decreased vision and patient was diagnosed having endophthalmitis. Intravitreal injections were given, and the patient was referred to vitreoretinal surgeon. Vitreoretinal surgeon took proper care of the patient, and the vitrectomy was performed and that is how the surgeon is kept clean because of all pre-op notes. Now about operative notes documentation, that is also very much important. Patient underwent cataract surgery, compromised vision, and the patient filed case post-operatively, but still the result was in favor of surgeon because the record mentioned that the patient is having posterior polar cataract, and as you know that patients having the defect in the posterior capsular area, they are likely to have some complications which the surgeon mentioned on the case sheet, and that is how the surgeon is kept flawless. Now OPD prescription is very important document. You should mention about the name of the patient, date when the patient came, treatment preferably in capital letters, duration of the drops which has been prescribed, and a signature of the doctor must be mentioned, and the review date. Date is very important part of the prescription because it can be manipulated in future as well if something goes wrong, and undated prescription can land doctor in trouble if the patient misuses it. This was the case which happened few days back. Patient developed glaucoma. Post-operatively, patient was given steroids for some period, and patient used it for years together, and patient landed up with glaucoma and lost his eye. But patient thought that doctor prescribed drop, and he developed this problem because of the drop only, and patient sued doctor. But those OPD prescription of the doctor clearly mentioned that the drug has to be used for so much time, for so much duration only. If patient uses this drop for longer period, he is likely to have some complications. So that is how the prescription should be legible, and it should mention about the duration of the drugs and the prescription and the prescribed drops for duration of the days. Discharge summary, another very important documentation. You should mention about the date of admission, discharge, date of surgery, surgical procedure which has been performed, and the treatment which was prescribed. And you should sign it properly with date and the name also. The referral letter is very important because it can be misused later on also by misinterpreting the date or manipulating the date and the month also. The duplicate of this referral letter should be kept with you with the patient's signature. Medical certificate is another very important document. It should mention about the identification mark and should have a patient signature because it can be misused later on also. MCI guidelines for record keeping, this is very important, but NMC in fact, this hasn't been clearly mentioned. For consumer forum, patient can approach as outdoor case within 2 years and indoor case within 3 years, and maintain the outdoor records for 2 years and indoor for 3 years. If patient demands for his case paper, it should be given within 72 hours. In pediatric cases, medical negligence, patient can file if he becomes major, and it should be kept till the patient becomes a major. In summary, medical record is an important aspect in one's medical practice. It not only helps to improve our patient management, but develops treatment plan, as well as it helps in the research, as well as to helpful in legal problems arise and suit in consumer forum. Thank you for your patience listening.